What if the vitamins you swallow every morning, the very pills you believe are preserving your health, are in fact accelerating your decline? Shockingly, a 2021 analysis in JAMA found that seniors taking inappropriate supplements face up to a 40% higher risk of premature death. After age 65, your body's ability to process nutrients shifts dramatically. Your liver's detox pathways slow, your kidneys lose efficiency clearing excess compounds, and fragile nerves become increasingly vulnerable to chemical overload. Yet millions of older adults continue to take daily vitamins that quietly erode heart, brain, bone, and nerve health, mistakenly attributing the ensuing symptoms to just getting old. In this comprehensive guide, we will first expose the 4 vitamins you should never take after 65, then reveal the 4 you must incorporate into your daily regimen, culminating in the single most critical nutrient linked to a 36% lower risk of death in seniors. European Journal of Clinical Nutrition 2021. Vitamin A in its preformed retinol or retinol palmitate form often sounds like a universal elixir, essential for vision, immune support, and skin health. Yet for people over 65, synthetic retinol can quietly accumulate in the liver and fatty tissues, reaching toxic levels without obvious warning. Because vitamin A is fat-soluble, your body stores excess rather than excreting it. Aging slows hepatic metabolism, meaning even routine doses, commonly 2,000 to 3,000 micrograms daily in many senior multivitamins, can lead to a chronic hypervitaminosis, A over months or years. Early signs of vitamin A toxicity are deceptively mild, dry, itchy skin, brittle nails, hair loss, headaches, and dizziness. You might dismiss these as just part of getting older, but they can escalate to blurred vision, severe bone pain, and joint stiffness. In a 2022 review in the European Journal of Clinical Nutrition, researchers linked chronic retinol overload in older adults to a 25% increased risk of atrial fibrillation, a dangerous, irregular heartbeat that dramatically raises stroke risk after 65. Your heart muscle, already subject to age-related stiffening, becomes vulnerable to calcium overload triggered by excess vitamin A. Instead of strengthening your vision and immunity, you're betting on a slow-burn toxin that mimics common geriatric complaints. Fortunately, you still need vitamin A for healthy eyes and immune cells, but not in preformed retinol pills. Focus on beta-carotene from colorful fruits and vegetables such as sweet potatoes, carrots, spinach, and mango. Your body converts beta-carotene into vitamin A only as needed, eliminating the risk of overdose. If your multivitamin contains retinol or retinol palmitate, switch to a formula with beta-carotene instead. Natural food sources, combined with a balanced diet, deliver exactly what your aging body requires, no more, no less, keeping your liver and heart safe. Iron supplements are marketed as an energy booster and anemia remedy, often included in senior multivitamins just in case. But iron is the one mineral that, once absorbed, cannot be readily excreted. After 65, when menstrual blood loss has ceased for women and overall iron turnover slows, the risk of iron overload eclipses any potential benefit. Excess iron deposits in the liver, heart, and pancreas, catalyzing the formation of free radicals and lipid peroxides. This oxidative stress damages DNA, accelerates cellular aging, and fuels chronic diseases such as Alzheimer's, cancer, and heart failure. Symptoms of iron overload are easy to overlook or dismiss: unexplained fatigue, joint discomfort, memory lapses, and abdominal pain. These often masquerade as arthritis, early dementia, or just aging. Yet behind the scenes, too much iron is charring your organs. In one study published in Blood, researchers demonstrated that elevated serum ferritin, a marker of iron stores, correlates with a 50% increase in all-cause mortality among seniors. Routine iron lab tests, such as serum ferritin and transferrin saturation, are essential before you continue any iron supplementation past age 65. Unless you have a physician-confirmed iron deficiency due to gastrointestinal bleeding, surgery, or diagnosed anemia, you should eliminate iron pills entirely. Most men stop losing iron after puberty and women after menopause. The modest amounts in a balanced diet, red meat, beans, fortified grains, are typically sufficient. If your multivitamin still contains iron, switch to an iron-free senior formula. Your liver, heart, and brain will thank you by functioning more smoothly and resisting oxidative damage. Calcium stands as the iconic bone vitamin, relentlessly advertised to seniors as a fracture-fighting panacea. Whole industries sell calcium supplements, claiming they protect against osteoporosis and broken hips. However, standalone calcium pills taken without adequate cofactors, vitamin D3 and K2, can do more harm than good, especially after 65. By that age, your bones' capacity to absorb calcium declines, meaning much of the supplemental calcium never hydrates bone tissue. Instead, it circulates in your bloodstream and lodges in soft tissues, arteries, cardiac muscle, and joints, where it calcifies and stiffens them. Several large meta-analyses, including one in the Journal of the American Heart Association, have shown that calcium supplementation alone increases the risk of heart attack by 24% and stroke by 15% in older adults. Those extra milligrams have nowhere beneficial to go, so they build up in precarious places. The typical senior multivitamin dose, 500-1000 magnesium a day, can significantly elevate blood calcium levels after meals, spiking calcification markers and undermining arterial flexibility. You may think you're strengthening your bones, but in reality you're risking your cardiovascular health. The smarter strategy is to obtain calcium from whole foods, dairy, leafy greens, sardines, almonds, and fortified plant milks. These sources package calcium alongside magnesium, vitamin K2, and other co-nutrients that promote proper bone deposition and prevent calcification of soft tissues. If you still require calcium supplements due to dietary restrictions, never take them alone. Always pair them with a D3-K2 formula to ensure that calcium reaches bones rather than arteries. And keep supplemental calcium under 500 mg per serving, consumed with meals for better absorption and safety. Vitamin B6 often lurks in energy-boosting formulas, mood support blends, and nerve health remedies, sometimes in doses far exceeding what's safe. At high levels, vitamin B6 becomes neurotoxic, damaging peripheral nerves and causing sensory disturbances that mimic diabetic neuropathy or age-related decline. Although B6 is water-soluble and generally excreted, doses above 50 mg per day, common in senior multivitamins or brain fog supplements, can accumulate in nerve tissues, particularly in older adults with reduced renal clearance. Symptoms of B6 toxicity unfold gradually: tingling or pins and needles in hands and feet, balance issues, muscle weakness in the legs, and even ataxia. Many seniors attribute these problems to arthritis, peripheral vascular disease, or simply old age. According to a 2019 clinical review in neurology, patients taking 100 to 300 tridae of pyridoxine B6 for months developed irreversible sensory neuropathy. By the time treatment stopped, many had only partial recovery. The official tolerable upper intake level for B6 is 100 mg a day, but research suggests that doses above 10 to 20 mg a day over prolonged periods can be dangerous for older adults. To protect your nerves, ensure any B6 in your supplements stays under 2 mg per serving, enough to cover daily needs, 1.5–1.7 mg a day, without risking overload. You'll get your daily B6 easily from diet: chickpeas, tuna, turkey, bananas, fortified cereals, and potatoes. Unless your physician identifies a clinical deficiency through blood tests, avoid high-dose B6 capsules altogether. Your nerve fibers will remain intact, your balance preserved, and your legs stronger. Now that you know which 4 vitamins can sabotage your health after 65, let's turn to the 4 you must take daily, starting with a mineral so commonly deficient in seniors. It's often called the silent epidemic. Magnesium is essential for over 300 biochemical reactions: energy production, nerve conduction, muscle contraction, and DNA synthesis. Yet by age 65, most people have lost 50% or more of their magnesium stores. Reduced dietary intake, decades. FOV soil depletion, common prescription medications, diuretics, acid blockers, and age-related malabsorption all conspire to create chronic deficiency. The consequences are pervasive: insomnia, muscle cramps, anxiety, osteoporosis, hypertension, arrhythmias, insulin resistance, and even increased mortality. A 2020 meta-analysis in hypertension found that magnesium supplementation in older adults lowered systolic blood pressure by an average of 4 mmHg and diastolic pressure by 2 mmHg, comparable to some blood pressure medications. In a 2018 Journal of Alzheimer's Disease study, seniors with higher magnesium levels exhibited a 21% lower risk of cognitive decline over 5 years. Another large cohort study showed that adequate magnesium intake correlated with a 34% reduction in all-cause mortality among those over 65. Not all magnesium supplements are created equal. Cheap oxide forms are poorly absorbed and often cause diarrhea. Instead, opt for magnesium glycinate or citrate, forms gentler on the stomach and superior in bioavailability. Aim for 300–400 mg elemental magnesium daily, split between morning and evening if needed to avoid gastrointestinal upset. You can also boost your intake through spinach, pumpkin seeds, almonds, black beans, and whole grains, but supplementation is typically necessary to restore optimal levels in older adults. Vitamin D3 is less a vitamin than a hormone precursor, required for calcium absorption, immune regulation, cognitive function, and muscle performance. After age 65, your skin's capacity to convert sunlight into D3 plummets by over half. With many seniors spending long periods indoors wearing sunscreen or living in higher latitudes, deficiency is rampant. In fact, over 70% of US seniors have blood levels below the optimal range of 30–50 mmol. In a landmark 2019 British Medical Journal meta-analysis, vitamin D supplementation in older adults reduced all-cause mortality by 13% and respiratory infection risk by 40%. Another randomized trial in JAMA Internal Medicine showed that D3 supplementation, 2,000 IU daily, decreased fall risk by 22% and improved muscle strength in participants over 70. Low D3 levels have also been implicated in depression, cognitive decline, type 2 diabetes, and autoimmune conditions, many of which disproportionately afflict older adults. To restore healthy levels, your doctor may recommend 1,000–2,000 IU of vitamin D3, cholecalciferol, daily, more in winter months or if you have severe deficiency. Liquid or oil-based soft gels taken with a main meal containing fat optimize absorption. Periodic blood testing, 25-hydroxyvitamin D, is essential to tailor your dose and avoid potential excess, which can lead to hypercalcemia or kidney stones. Vitamin B12, the cornerstone of nerve health and red blood cell formation, becomes increasingly difficult to absorb from food with age. After 65, up to 30% of individuals develop food-bound B12 deficiency due to atrophic gastritis and decreased intrinsic factor production, necessities for absorbing protein-bound B12 in meat, fish, dairy, or eggs. While many multivitamins tout modest B12 levels, 2 to 6 Ug, seniors often require 500 to 1,000 Ug daily to bypass malabsorption and replenish stores. Untreated B12 deficiency can lead to pernicious anemia, irreversible peripheral neuropathy, unsteady gait, memory loss, and even psychiatric disturbances. One prospective study in neurology found that seniors with subclinical B12 deficiency had a 60% higher risk of dementia over 5 years. Another trial demonstrated that monthly B12 injections, 1,000 Ug, reversed early neuropathy symptoms in over 70% of participants, restoring sensation and preventing falls. Since B12 is water-soluble, excess is excreted, making supplementation remarkably safe. Many clinicians recommend sublingual or high-dose oral methylcobalamin, 1,000 Ug day, to ensure absorption independent of stomach acid. Annual screening of serum B12 levels, methylmalonic acid, or homocysteine further personalizes therapy, ensuring you maintain optimal nerve, brain, and blood health. Topping our list is omega-3 fatty acids, EPA and DHA, the one vitamin that epidemiologists consistently link to improved longevity, cognition, and cardiovascular outcomes across every age group, but especially in seniors. A 2021 European Journal of Clinical Nutrition cohort of over 42,000 adults over 60 reported that participants with the highest blood omega-3 levels experienced a 36% lower risk of death from all causes over a 10-year follow-up. Another landmark study in Circulation found that fish oil supplementation reduced fatal heart attacks in seniors by 45%. Unlike plant-derived ALA, EPA and DHA from marine sources integrate directly into cell membranes, reducing inflammation, improving arterial flexibility, stabilizing heart rhythm, and supporting synaptic function in the brain. Clinical trials show that 1,000–2,000 mg of combined EPA-DHA daily reduces age-related macular degeneration risk, slows cognitive decline in early Alzheimer's, and improves joint pain in rheumatoid arthritis. Quality matters. Choose a purified, heavy metal-tested fish oil or algae-derived DHA supplement, ideally in triglyceride form for superior absorption. Take with food to minimize fish burps. If you have clotting disorders or are on blood thinners, consult your physician, as high-dose omega-3 can further thin blood. For most seniors, however, the benefits far outweigh the risks, providing a broad shield against age-related disease and functional decline. By now, you can see that age doesn't demand a scattergun approach to supplements. It requires precision, removing the 4 vitamins that accumulate toxic residues or exacerbate calcification and oxidative damage, while introducing the 4 that your aging body truly depends on for heart, bone, muscle, and brain resilience. Your prescription after 65 is not simply take a multivitamin. It is a carefully curated regimen. Eliminate synthetic vitamin A, retinol, iron, standalone calcium, and high-dose vitamin B6. Optimize with magnesium glycinate, 300 to 400 mg a day, vitamin D3 hasan 2 iude, vitamin B12, masan yuge methylcobalamin day, and omega-3 EPA DHA, 1,000–2,000 miron daily. Before making any changes, discuss your personalized plan with your healthcare provider and order the relevant blood tests. Liver function, ferritin, iron saturation, 25-hydroxyvitamin D, B12, and a full electrolyte panel. Armed with data, you can correct deficiencies and remove toxic excess, ensuring every pill you swallow serves to extend not just your lifespan, but your health span. Your biological age is not written in stone. By choosing the right supplements and ditching the harmful ones, you can rewrite your body's story. Fewer hospital visits, sharper mind, stronger bones, steadier heart, and nerves that carry you confidently into your golden years. Which vitamin surprised you the most? Let us know in the comments. If you found this deep dive eye-opening, please tap like, subscribe for more science-backed longevity strategies, and click the bell so you never miss an update. Here's to living stronger, longer, and smarter, one pill at a time.